Hello and welcome to your channel, your path from BDS to DMD. So as promised, today we will talk about how to prepare for application. Hope you all are well. Hope you all are super excited because I am very excited to share the next step of my journey with you. So what are we going to talk today? As promised, how should I prepare for my application? So we are going to divide it in two sections. The first section will be for students who are either in D3, D4, which is third year, final year, or who are in their internship. And the second section, I'll talk about people who are practicing professionals, whether you are clinicians, you are academicians, you are practice owners, or you are administrators. The reason I'm breaking down this particular thing in two different sections is so one, I can talk to students and your strengths will be very different than the strengths of practicing professionals, and two, at the end of the video there are some common strengths and some common tools that both of you can use. So talking about the students, first of all, congratulations. As D3 and D4, I'm sure you've started your clinical dentistry, the real world dentistry, and I hope you're thoroughly enjoying it. Because for me, when I saw my first patient, I was so excited. I still can feel that excitement, and it has been a really long time. But I can still feel it. I literally am reliving that as I'm speaking to you. So let's see, what are your strengths as a student and how can you start preparing in your D3, D4 and internship years for your DMD program. So for some, it may sound that, oh my God, why are we planning like so many years before the application? Because the earlier you plan, the better it is for you. So let's see. What if you are D3, D4 and interns? So your first patient, your first day in the clinic, your tabletop demonstrations that you may be participating in, your volunteer work, whether, I know in India you have community camps, you have tobacco rallies, you have, anti-AIDS campaigns, and there are so many clinical and non-clinical things that you may be involved in. You could be a president of Lions Club or JC's Club, or you could be your class president, or you could be working with schools, where your younger sister studies, or maybe a niece and nephew, and you go there and you talk to the school children there and you hold community camps. Or this is something that I did when I was in India. I used to visit a lot of rural villages through our community dentistry program, and we would go there and we would teach people how, proper brushing technique, proper flossing technique. We would talk to them about nutrition counseling, dietary counseling, how drinking water is so important for the health of your teeth. I remember personally talking to a lot of women who were pregnant and educating them on maternal and child health, prenatal health, and how um, dental and the oral cavity affects their overall, oral health related quality of life. And that is something which is a very big and an important aspect. So once you are working on all these things, make sure you document them. So what I mean by documenting them, so let's say you went to a camp, um, take a photograph and upload it either on your Google Drive or some place that you're going to keep it, and take photos with the entire group. Not only are you creating memories, but you're also documenting every place that you have gone to, and make it a habit. Either have a pen on paper, or so I'm a pen paper person, but then, if you're not, if you are more tech savvy, what you could do is have a document on Google Drive, and then every time you do something, keep adding that thing to that document. And believe me, you'll realize that by the time you're in your internship, you have done so many things. One other thing you could do is, as maybe not as D3 students, but as D4 and interns, is, let's say you placed a crown, or there was a very difficult extraction that you did, and you have a patient who's super happy with you. We always have cell phones these days. Make sure you have an informed consent and a photography and a video consent signed by your patient, once they sign that consent, you could take a 30-second video saying, and the patient can say what was their experience with you. Um, how did they feel, the way you treated them, how happy they were, and how you have excellent chairside manners, and how before, you're not someone who just goes there, injects an LA and takes the tooth off. No, you take time, you take the patient's blood pressure, you sit with them, you talk to them, you ask them about their pain, you ask them a lot of things. And I think that is extremely important for you to document. And once you have such clips and videos, you can always use them as a testimonial, which you can either have like a small hidden private Facebook page that has these videos uploaded, or you could upload them on a Google Drive. And when you are invited for an interview, or um, you're shortlisted, you could always say that, hey, is it okay for me to share a few things that my patients have? So I remember when I was in dental school and I was finishing my BDS, I had a lot of patients who really liked my work. They did appreciate the fact that I was learning, and when I needed help, I would, go to the professors, ask them for help. But my goal was always to give my patients the best treatment possible that I can. And I had so many patients who brought me those small little thank you cards, saying, thank you, Jasmine. And, some of them were written in Marathi. I'm from Maharashtra. And, small gestures. There was one of my patients who actually got me flowers from his gardens. And this was someone who I want to say was in his late 80s, and he was such a kind guy. He actually brought it for the entire team as a thank you of how we treated him. Now gestures like this, they do make us happy, and I think gestures like these and some situations like this need to be documented. And when I say documented, you always don't have to have a video or a photo, but if you do, you make sure, because my next video series is actually going to be about statement of purpose, and we'll talk more in detail about why I'm telling you that this is very important. So let's go. So currently, I also work as a director of recruitment, and I am the head of talent for a very big dental group, and so my job is to bring them the best talent for almost 78 practices, and I have a team of recruiters that report to me. So that's when I have this lecture series, when I go and speak to schools, to the DMD students who are graduating, because eventually they are looking for a job, and I interview them so I can place them in these offices. And that's why when I look at a lot of people's CVs and resumes and what they have done, I think I learned that documenting is the key. So let's say you are a D3, D4, an intern, and you're graduating. So you're like, okay, what are my next steps? One, study and concentrate on learning clinical skills. This is the most important thing. Whether you are going to do a DMD or not, school is the best place to learn. Make mistakes, learn. You have professors who can rectify those mistakes. You have seniors, you have residents who can help you. The next thing is polish your clinical skills. So don't restrict yourself just to school. Once you're done from the 9 to 5 or 9 to 6 school, at least twice a week, try and shadow some other dentist, whether it's a friend, whether it's a professor, even if it's unpaid, go and learn from them, because sometimes it's very easy to learn when you look at chair side, the same work being done, versus when it comes to reading a book. Social media, Twitter, LinkedIn, Instagram. This is really important. So, and if you follow Instagram profiles of a lot of DMD students here, you'll see they're very excited and very genuine in documenting everything. The first wax carving, the first tooth that you prepped on plaster, the first plastic teeth that you cut a cavity on or made a crown, your first denture, your first teeth setting, because this eventually is a part of your CV. This is exactly what you've done and grown. And I think one thing I can tell you is that the dental schools, when they're looking for an advanced standing or an international standing class, um, they are looking for a mix of students. So please do not go by what blogs or other things say and scare you. I had classmates who had just graduated from dental school and they were my classmates, and I had classmates who have been practicing for almost 15, 16 years and they were also my classmates. So we had a very nice and beautiful cohort. And I think the goal of an advanced standing program is to bring a class and students, because as I said in my last video, if you remember, you're not the only one looking at the school, but the school is looking at you. So basically, you're also judging the school and the school is also selecting the right people. So the school is looking for someone who can add value to the school culture. And therefore, you may have a very unique skill, which is just unique to you. So do not take any skill for granted. If you are an artist, if you like pencil sketching, that is an art. Make sure you put that in your CV, that that's something you like. If you play piano, um, if you play any other instrument, make sure you add that. And one thing I can tell you with confidence, that a lot of medical schools actually do prefer applicants who have something in their extracurricular activity. Of course, they're looking for people who are very strong academically, but they also are looking for people who have some other hobby and who have some other skills. Because remember, we are dentists, we are artists, we are people who are working with human beings. So under any circumstance, under any situation, we have to remain calm, and that is what they are looking for. So utilize your Twitter, your LinkedIn, your Instagram to your benefit. If someone's doing some kind of research and you find them on Twitter, retweet that and put the correct hashtags. And also, this brings to the next most important thing. Please make sure you're very careful about what you're putting on Facebook, what you're putting on Twitter, what you're putting on LinkedIn, Instagram, Pinterest, anywhere, because you never know who is looking at your profile. You never know. The schools may have access to that, or in some situation they may request an access for that, and that is completely acceptable and permitted for them to ask. So please be careful. Just remember one thing: whatever goes on the internet stays there forever. So be very vigilant of what you put there. Next thing is continuing education. Attend seminars, attend podcasts. I remember when I was in dental school, our oral surgery professor, Dr. Shinoy, he used to, and Dr. Pillai, they used to take us to other dental schools in the area which had residency programs, and we would attend oral surgery conferences with them. And that was very informative. Plus, it helped us with learning new skills. And, I did add that to my CV. And when I interviewed at a school, they were very impressed that, as an undergrad, these were the things which schools in India were adding to people's curriculum, and that the schools were encouraging people to go and attend such conferences. So please do not take any conference or anything you've done for granted. Attend networking events. When I say attend networking events, is go and meet a lot of people who have a similar thinking as you. Try to form some kind of groups where you can speak to people who are applying. And believe me, no two applications will ever be the same. So even if you share knowledge, you're not creating competition. That's something I can say with confidence. Um, you don't have to share every single detail, but the more ideas you exchange, the more oh, maybe this is something I could have done, or this is something that I can do. And then, as I said, you observation at dental practices. If you see, I'm going to try to see if I can move my Windows screen and give you a better idea. But what I said here is like, for the green bar says 12 months, which means study and concentrate on learning skills 12 months, how to prepare 12 months before graduation. In the last 6 months, polish your skills. Use social media and Instagram in the entire 12 month. The last 3 months, you could do a lot of CE courses and attend networking events. But I think this should be a constant learning curve. Let's go to the next slide. What if you're an MDS student? Oh, I forgot to tell one thing. if you are a D3, D4 or an intern, you can always request MDS students if they are doing some kind of publication or some kind of research. You can always go and become their research assistant and request them that, hey, um, can I please help you in something? Is there something that I can do? If it's someone in prostho, you can always say, do you need my help in setting teeth? Or do you want me to come and be your assistant when you're doing some full mouth restorative cases? Or if you have someone in ortho, you can always say, if there is a difficult cleft or bigger cases where they're putting like an obturator or something, you can go and ask that, can I please come and volunteer and I'll help you in anything that you need. And the chances are, if it's an MDS resident who really feels that you have helped them, maybe they will put you as a second, third, or fourth author in their publication. And hey, you just had a publication under your name. So make sure you definitely volunteer. So let's go back to MDS students. What is it that MDS students can do different? One good thing with MDS students is that you're already a dentist, so you already know how to treat patients, and therefore that makes your documentation of cases stronger, and that is your USP, the unique selling proposition. So what MDS students can do is, when you start a case, document the time that you started, take photographs, every single detail. So treat every case as if you're publishing results. And then, you'll be surprised by the end, by the time you graduate, you'll have an entire binder full of cases. I know some dental schools in India have a mandatory requirement for MDS students to document every single case of theirs as if they are going to use that case for thesis purpose, and that really helps you to build your own portfolio. So for MDS students, I think the key is building a very strong portfolio, and that is going to differentiate you, and that's going to be your unique point when you apply for the DMD program. The other thing to keep in mind for MDS students is you bring very different skill sets to a class, because you are a specialist. You specialize in something, let's say ortho, pedo, perio, endo, prosto, whatever your specialty is, radiology, diagnosis, oral pathology. There are so many specialty that you can graduate as an MDS, and that unique skill of yours adds value to the cohort that a school is looking for. But there's one request that I have for MDS students and professionals both, that when you come to the United States, yes, you may be a very well-known and a successful person in your home country, but when you're wanting to study in a school here, please make sure that you have the hunger and the greed to study, to learn more, because schools want to have students in their cohort who they can teach. If you already know everything, then why do you want to go to school? And that's something people would think. The first thing that would come to anybody's mind is, oh, if you already know everything, then why do you want to go to school here again? So please come with an attitude of being humble, um, the attitude of learning, the attitude that, yes, I am greedy for knowledge. I want to learn more. I want to serve my patients. I want to do what is in the best interest of my patients. If you come with this attitude, the sky is the limit. So this is something that the MDS students need to just keep in mind, and especially professionals. And I am not saying, please do not interpret this in any other way. This is just my general observation that and this happens in a lot of classes, that you're the professor in a school and you have a student who graduated who was your student, but you both may end up in the same class in an advanced standing program. And that is the beauty of these programs, that as I said, it's a very beautiful melting pot, an amazing amalgamation that you get to experience. So let's go to the next slide, which is for the professionals. So who would I consider professionals? Would be clinicians, academicians, practice owners, and administrators. With this particular cohort, I think this will be the most experienced of the lot, because you are clinician, so you've already treated cases. You're academician, so people like me may have been your students, but you are moving to US maybe for either a better living, or maybe for your children's future, or maybe you want to experience a new culture, and you may be planning to move with your family, and that makes you really unique, and that is your strength. Same thing with practice owners and administrators. And when I say administrators, is because I have a very strong managerial and administrator background. I've worked in the US for almost I want to say 10 years, um, in management of dental practices. And I've also worked as a clinician, and I still continue to do both. So I feel, just because you went to dental school in India, but you are, let's say, for example, there are few big ISO certified hospitals in India, and if you are working with them either in their medical coding section, or um, you are their infection control specialist, or if you're their dental director, please make sure that this is your strength. These are the skills that you're bringing to the table. So as I said before, um, please consider every single skill as unique. Please do not consider any smallest skill that you have thinking that, it's not such a big deal. You never know. There may be a school which is looking for administrators eventually. And believe me or not, the dental profession, dentists or physicians in general, it's very hard to find people who are in the business side and also understand the clinical side. And that was one of my strengths. And I think that made my application unique. And as I said, I had classmates who were MDs, who were professors, and that made their applications unique. I had classmates who had served the military as dentists, and that discipline that they bring, that was their unique strength. I had professors and uh, vice deans of colleges, and I think they brought in a very unique perspective of understanding a student. What is different, what can change, um, and so overall, every single person and every single applicant has some strength. And that is one of the reasons I have a very sincere request for all of you. It's a very sincere and humble request. Please make sure that everything and anything that you submit is your original work, whether it's your CV, whether it's your resume, whether it's your statement of purpose, professional statement, letter of recommendation. Anything and everything has to be written by you or your professor in case of letter of recommendation. Please do not copy paste, because um, I'm not sure what software does ADIA and CAAPID have, but as I know, being in recruiting and talent acquisition, we have softwares where everybody's CV gets uploaded, and then in school when you're studying, they do have plagiarism software where if your work matches somebody else's work, the software tells you immediately that there is this much percentage of match. So please, please, please make sure that everything you write and everything you submit is authentic, is original, and is your own, because that is what is going to create value. And at the end of the day, that is the goal. Like, you want to come to the United States to get a DMD, to add value to your life, and at the same time, you want to add value to the system. And I think that is very, very important. Social media. I did speak about it a little bit before, but I want to stress on this again. Use social media as a beautiful tool that is going to help you in success. So whether it's Pinterest, Google Plus, Facebook, Flickr, you can write your own blog. You So basically, what I feel is social media adds value. It helps to build relationship. um, Most important thing, it's like your constant sales pitch. So it's like you're marketing yourself constantly. Just make sure that, especially if you're going to use patient cases to put on social media, make sure you have consent. I am not a biggest advocate of putting photos that have blood in them online because everybody wants to see a clean feel. You don't want to open a Facebook early in the morning and see, um, we have textbooks for that, and we have, you know, uh, I know you understand what I'm trying to go to. That there are ways in taking, especially like if you're doing veneers, you can always have a clean field. If you have crowns, you can always make sure that, the blood is clean, and when you take a photograph and document it, because at the end of the day, you want to make sure that it's aesthetically pleasing to the eyes when you share it with someone. I do understand that in certain situations, yes, you have to, but please make sure that your entire Facebook or Twitter doesn't look like that. People should be excited to come to your page, and not a turn off. Right. So that brings me to the conclusion of today. Thank you so much for listening. Thank you so much for being an amazing, amazing, amazing audience. Um, I really genuinely care about every single person who's going to apply to dental schools, and I want your journey to be very happy, very exciting, and therefore I'll try my best to share as much information that I can. Again, I said everything that I share here, they are my views. I'm not getting paid by anyone to advertise for them. I will in future, I cannot promise, but I will in future try to see if I can get some alumni from different schools to come and speak with all of you online, so you can ask questions about those specific schools. And I'm going to try to reach out to a few schools to see if they can get me some more information. But if you have any questions about, um, what needs to go on the application, how should I prepare, please feel free to drop me a message. If you have any questions, if you want me to answer anything specifically, please let me know. Um, so what's going to be our next video? It's going to be resume versus CV, and what can you write in an SOP, and how can you make your professional statement super unique. This is going to be one of my most exciting video because, this is something that I work on day in and day out. Every single day I look at least, I want to say 45 to 50 resumes, and at any given point of time, I have a team that's working on good 75 to 80 job openings in the dental field. So this is something I'm very, very excited to share with you in my next video. Please feel free to drop me any questions. Kindly like the channel, subscribe, and please feel free to share it with your friends and family. Good luck with your journey, and I hope I get to see all of you in the United States become a DMD very soon. Take care. Good luck.